I would like to share a little bit about the medical procedures I had done by Dr. Tambar in the last year and a half. And I am 66 years old, and 2 years ago I injured a ligament in my knee, which caused my knee to just flare up with a lot of pain and swelling, and it was difficult for me to sleep, put my weight on it. I saw 2 different orthopedic doctors. The first one gave me a cortisone injection, which relieved some of the pain and inflammation. It wasn't very long lasting. I saw a second orthopedic doctor, and he looked at my MRI, saw that I had a tear in my meniscus, and recommended surgery. Because I didn't know where else to turn and I had dealt with months of pain, I scheduled that surgery. In the meantime, I found out about Regenerative and was very intrigued by their approach and made an appointment with Dr. Tambar. He looked at my MRI, did an exam, and asked me what question I had. And I said, well, should I have meniscus surgery? And his response was, absolutely not. That's not where your pain is coming from. And so I was very relieved to cancel my surgery, which was 6 days later. And I made an appointment for PRP injections, which I did a couple weeks later. And I would say the procedure was not very painful. He numbed my knee. I did have an injection into my patella, a bone augmentation, and that was a little more painful. But the whole procedure lasted, I don't know, maybe an hour or so. And I went home with a knee brace and some crutches and some pain meds, which I took for a couple days. And my knee was pretty swollen. But over the course of a couple weeks, it just got progressively better. I found myself being able to be more active. In fact, 3 weeks after my procedure, I did a hike that was about 1.5 miles long using my brace and a walking stick, and I just continued to show steady improvement. And 1.5 years later, I would say that knee is about 90% better. A few months after that happened, I injured my right knee while biking. And so we did the same PRP procedure to my right knee. And I had about 20% improvement. So Dr. Tambar recommended that we escalate to a stem cell treatment, which I had done 1 year ago. And we did the 3-step process with the prolotherapy, the stem cells, and the PRP over the course of about 10 days. And I was a little concerned about taking out the stem cells out of my hip, but I would say that the pain involved in that was maybe about a 2 out of 10. I went in the morning, and my hips were a little bit sore afterwards when I walked, but definitely not anything that was overwhelming. And then in the afternoon, he did the injections. And I would say the first 24 hours after the stem cell injections, my knee was pretty swollen, and I was pretty sore. I took pain meds every 4 to 5 hours. But after that 24-hour period, the pain lessened quite a bit, and I did wear my knee brace for a number of weeks afterwards, but I saw my knee just get progressively better, and I was able to increase my mobility quite a bit. During the course of that year, with the pain on and off, I was not able to walk more than half a block. I sometimes rode in the little carts at the grocery store because I just couldn't walk around the whole store. And so it was quite a year of struggle with my knees. I had no idea I had that much arthritis in my knees. I had always been pretty active previously, biking and walking. And so I was a little bit shocked by all of the pain that I had kind of gone through. But I'm so grateful for Regenerative and for Dr. Tambar and for the procedures that I was able to have done to avoid surgery and to avoid the options that traditional medicine offers. So my knees are doing great. My left knee is about 90% better, and my right knee, I would say, is about 80 to 85% better. And then this past year, I had my rotator cuff flare up in my shoulder. So I scheduled a PRP injection with Dr. Tambar. After having an MRI, we discovered I had calcific tendinitis. And so he did two different procedures, or two procedures, where the first time he removed some of that calcium using a syringe and some pumping action, and that improved my pain level about 40%. I had so much pain I could hardly move my arm, I could hardly sleep. And then a couple weeks later, we did the PRP injections. And 4 months later, I would say my shoulder is about 80% better. So I'm very pleased with Dr. Tambar's expertise and the staff there, and I'm so grateful to have been able to undergo these treatments and avoid a lot of the procedures that traditional medicine would have recommended. So I highly recommend the PRP and the stem cell injections as an alternative approach to joint health.